As you know, you're about to excitingly start your Invisalign journey, and we wanted to send you this really short video in order to be able to show you what to expect, how Invisalign works, and what are the kind of things that we will do and ask you to do to make sure your treatment is seamless and your results are incredible. So as you can see, this is an Invisalign box. We receive all your aligners in one go. Naturally, the number of aligners varies from who we're seeing and how complicated cases are, but usually the first time that we see you, we will give you enough aligners for 1 month. These are the aligner packets. They are usually numbered 1, 2, 3, so on and so forth. On the first appointment, we will usually give you 3 aligners. On these aligners, we will write down in the boxes below the dates that we would like you to move to the next aligner. The first aligner, in order to allow you to get used to the process, a little bit like training wheels on your bicycle, is worn for 2 weeks. That gives you some flexibility and allowance when you may have social situations or work situations where at the start you're not fully comfortable with how the process is going. Aligner number 1 will be fitted at your next appointment, which should have already been organized by our lovely receptionists. If it hasn't, or if there's any changes that you need to make to your appointment, please give us a call or send us an email or WhatsApp. Aligner number 1, as I said, will be worn for 2 whole weeks. 2 weeks after your first appointment, we're going to ask you before you go to bed to put aligner number 1 back in the packet that it came from, and then to open number 2 and pop that in. 1 week later, exactly the same process, pop number 2 back in the packet that it came from, and in the evening before bed, take number 3 out and pop that one in. Your target time ideally to wear these to ensure that they work is 21 to 22 hours per day. That means you have to take them out when you eat and when you clean. When it comes to eating, it pretty much means anything, whether it's a biscuit or a 5-course meal, just remove them in order to be able to eat. It's much easier, it's much cleaner, and it's much safer. In order to drink, most clear liquids you can drink with the aligners in, especially water. But if you're drinking anything with a high sugar content or a high color content, it would be wise to either remove the aligners to drink that drink or use a straw, as the straw passes the liquid past your teeth and down your throat. When it comes to cleaning, it's mandatory as normal to clean your teeth and your aligners twice a day. That means in the morning when you wake up, you remove the aligners, you brush your teeth, you floss, and you mouthwash. At the same time, use your toothbrush and your toothpaste to scrub the aligners and rinse them at all times with room temperature tap water. Nothing hot or nothing boiling. You can also chemically clean your aligners. Chemical cleaning is optional, but a lot of people do like to use it. Invisalign give you what we call cleaning crystals. These are available for reorder on Invisalign's website. I must admit they're quite expensive, and general feedback is they don't last that long and sometimes taste like chlorine. Given that, what we have done for the last few years is started to provide people with an alternative. This is called Retainer Bright. This doesn't taste like chlorine. It's relatively inexpensive. About £25 on Amazon buys you over 100 tablets. How often you chemically clean your aligners is completely up to you. We usually suggest once or twice a week, but naturally if you're a smoker or a heavy tea and coffee drinker, you may wish to do that more. How this works is you simply put a tablet in room temperature tap water, pop your aligners in it and leave them for about 20 to 30 minutes whilst you're having a meal or having a chat. Come back to them, give them a rinse and a brush, and pop them straight back in again. Another handy thing that Invisalign provides you is a carry case. The carry case is super important in these times where we're all on the go and we want to keep our aligners clean and safe. If your aligners are not being cleaned or if they're not in your mouth, please make sure you keep them in this carry case and keep this safe. The majority of people that lose their aligners wrap them in tissue and leave them on a countertop or in a restaurant, and somebody clears that surface and they're gone. A lot of people also damage them by putting them loose in their bags, and unfortunately other items in their bags damage the aligners. So this keeps it safe and away from harm. The remainder of our starter pack that Invisalign provides you, we have a little information sheet at the top about how to insert and remove the aligners. That has got illustrations in it, but it's also something that I or your treating dentist will show you at your fit appointment. Similarly, behind here is an information booklet, and that includes everything that I'm talking to you about now for a repeat kind of information if you need it. Obviously, you can rewatch this video or contact us if you have any questions whatsoever. We're always happy to help. The last few things to discuss are what to expect when you start Invisalign. It is normal to expect some discomfort from Invisalign. For those of you that have had fixed braces in the past, you'll be pleased to know that it's much, much, much less than when you have fixed braces. Invisalign is gentle and slower and therefore more comfortable. However, everyone's discomfort threshold does vary, and that might mean that you might need to reach for a paracetamol, an ibuprofen, or a painkiller of your choice to help, especially at the start. We promise you that as the teeth start to move and you get more comfortable with the processes, things will settle down, that discomfort will go away, and you will feel a lot better. Similarly, these aligners that I showed you earlier are made by a 3D printer. Therefore, sometimes you can find that one of the aligners has a slight sharp edge on it, and that might need a little bit of adjusting if it is irritating your cheeks or your lips or your tongue. That's why, through all our experience, we provide everyone with a nail file. This is a get out of jail card. We're more than comfortable and happy for you to pop in to have this done with us, but we're also aware that our patients have lives and jobs and things to do, and they can't always drop everything to run and see us. So this is something that you can use to file down the sharp edge that you might feel. And please do report it to your dentist if you've had to use it, so we know for the future that we need to help in that aspect. The aligners on your fit appointment will be fitted appropriately. There will be attachments which are white tooth-colored filling materials. They will be attached to your teeth and they will aid the aligners in moving your teeth. Your dentist will have already discussed the use of these with you. The aligners are very strong, they're tooth-colored, and we use a composite filling material that matches the shade of your teeth to try to make them as inconspicuous and invisible as possible. They can, however, occasionally come off. And if they do, please don't worry. Whenever you have reviews with your dentist, we will be checking, we will be replacing them, because we will always know if something's not quite right there. When you insert and remove the aligners, depending on which ones you're having, whether you're having upper, lower, or both, we provide all of our patients with something called Chewies. Again, these are available off Amazon. They're very, very inexpensive, but these are reusable, sterile silicone rubber cones. They are designed for when the aligners are pushed in to be bitten on in multiple places in order to push the aligners into position to get them really engaging your teeth and really moving. Your dentist will show you how to use these specifically at your fit appointment. The last few things with Invisalign are that there are no real dietary restrictions. However, from experience, we have noticed that some things, especially things like turmeric, will stain your aligners and your attachments, and it's something that we generally ask patients to avoid where they can. Teeth will start to move, and as a consequence of that, your bite is also going to change. Part of your bite changing week on week means that your muscle memory, the thing that tells your brain how you bite together, is going to be lost. But we promise you that once your treatment is finished, whether it takes a few weeks or a few months, that normal feeling will come back to you and things will feel much more comfortable. So please don't be alarmed that if during the treatment things feel a little bit uncomfortable when you're trying to chew certain foods. The final thing is that in order for teeth to move from point A to point B, they do sometimes have to become slightly loose to move. It is something that genuinely alarms a lot of our patients. and a lot of patients using Invisalign worldwide. And that's completely understandable. The point of this video and the point of this information is to explain the things that you might expect to happen but may not. And if they do, it's designed for you not to worry about them. In order to move your tooth from point A to point B, your tooth or teeth have to become slightly loose. It's a little bit like trying to move your car with the handbrake on. If your handbrake's on, your car's not going to be able to move from A to B. And it's the same thing with teeth. But we assure you that because we review you regularly, and because we only do treatment on patients who we've assessed fully and we know their risk factors, you'll be fine. And once your teeth are lovely and straight and your retainers are fitted, any of those issues, if they even occur, will disappear, and you'll forget about them very, very quickly. So we're super excited for you to start Invisalign. We wanted to film this video to give you the kind of information that you need for your start appointment. If you have any questions about the information that I've said in this video, please ask your treating dentist and they will happily explain everything that you need to know. Please rewatch the video as many times as you want. If you lose it, please ask us to resend it to you because we'd be more than happy. And it's really important to us that your Invisalign journey is tailored to your lifestyle, your needs, and the overall plan that we've all decided is the best. We look forward to seeing you. Take care. Thank you very much.